So after you take their database, you ask what their chief complaint is, you ask them how it happened, how long ago it happened, where it hurts the most, does anything make it feel better, have you ever had a bilateral injury, what makes it feel worse, and you ask them to describe the pain, like is it burning or aching or tingling or anything like that. And then you do, you observe for like the level of their shoulders, if they're even, and you observe the position of their scapula. You get behind them and look at their scapula. You can also look at their spine, and then you start palpations. You can palpate the SC joint, and you can palpate across the clavicle to the AC joint. You can get the acromion, and then you can, and the coracoid process, and you can go down to the humeral head and get the greater and lesser tuberosity, and you can go ahead and palpate the whole humerus. And then you get the scapula, the spine of the scapula, and all the angles, the lateral angle and the inferior angle, and the medial angle. And then you go ahead and do some special tests. You try active range of motion. You ask them to do abduction and adduction and flexion and extension. Go all the way back. And then you can also do internal and external rotation. And then you can go ahead and do passive range of motion, where you do it for them. You do abduction, adduction, flexion, extension, then external, internal rotation. And then you can do some other special tests for AC. You ask them to abduct their shoulder and then touch their other AC joint. And you can do Yergesons, where they try to resist you moving them, like they're hitchhiking. And then you can also do sulcus tests that checks joint stability, where you pull down on their arm. And then to check for dislocations, you ask them to lay down. Yeah. Can you scoot over this side? Sure. Thank you. And you externally rotate their arm and push down. It's called apprehension. And reach it up for me. We stand. This is called Gerber liftoff, where you put your hand like this and you lift off your back. And another one, can you touch your other scapula? And then you can also do Allen's test. Put your hand like this. And I'm going to check your radial pulse, and I'm going to move you back. Can you look that way? Make sure they have a pulse. And can you put your hands in the scaption and try to resist me pushing down? That's the empty can test. And also, can you go all the way up and then come down slowly and stop it right there? Then I'm going to tap. And that's it.